Dr. Ridha, who's a senior lecturer in the Department of Mechanical Engineering and is jointly a member of Center for Advanced Manufacturing Material Processing at the University of Malaya. So he obtained his Doctor of Engineering from the university in Japan in 2015 and specializing in magnetic abrasion finishing for finishing tube internal surfaces.
Thank you, Prof. Victor and Dr. Mazuki. Okay, virus infections through air and by an infected person could be from coughing, sneezing, speaking, or simply breathing. A proper understanding of the airflow in the environment could allow us to prevent infections by the practicing of social distancing, use of facial mask, and applying proper air ventilations. Okay, today I will present several case studies on infections linked to air ventilations, and then we will see several CFD or computational fluid dynamic analysis, the study of airflow in confined space. From this study, how a safety zone could be designed and created, and then we can maybe have an idea how we could apply the study to reduce the risk of infection for the current pandemic. Next, okay, I will show some experiments to measure bioaerosols emitted from human through coughing and sneezing. And then we will cover some details on airborne transmissions of SARS-CoV-2. And then finally, we will see a few scenarios of virus infections and how we can reduce the risk of infection by applying several preventions methods. Okay, upon understanding these details, okay, we could rethink how to implement effective measures to reduce the risk of virus infections at our workplace. Okay, for the case infection case 1, okay, it was reported, okay, at a choir practice for the length of 2.5 hours. There were 61 participants in this choir practice. It was found that 32 cases positive and 2 persons died. The activity, the singing activity itself contributed to the transmission through the spreading of aerosols and droplets. The data from the experiment, the research, the study has suggested there were several super emitters that cause broad transmission, which is the singing activities itself, and it was suggested within this person, there was some person that released extraordinarily more aerosols that contributed the super spreading events. The infection case number 2, where the event took place in a restaurant in Guangzhou, China. 83 persons were at a restaurant. Out of that numbers, 10 was ill and positive, and 33 others were close contact, so they were quarantined for 14 days. During the quarantine period of 14 days, it was found that these close contact people had no symptoms and no infections. From this study, it was concluded that airflow was consistent with the droplets transmission in the restaurants where the aircon outlet and the table seating had been positioned. From the figure here, we can see the aircon and the flow inlet and the infected persons. It was suggested that the recirculation of this airflow has contributed to the outbreak. In the next case, infections case 3, okay, there was 4 key factors that had driven these spreadings. Number 1 is proximity. Number 2, prolonged contact. Number 3, numerous people. And number 4, enclosed space. In this case, a staff at a call center in South Korea worked together in a 13 workstation located around the middle here. Out of that group, 9 were tested positive. So in this space or big office, there was 137 workers. After that, it was found that 79 workers were positive. However, in the same floor, there was other rooms and offices too. It was found that people in other spaces were far less infected. This has shown that confined space could lead to a higher infections. Okay, in the infection case study number 4, at a ceremony, 2 buses was used to transport people for a duration of trip for about 100 minutes. 1 woman on 1 bus was infected without any symptom. However, the next day, she had showed some symptoms, and on that same bus, 23 passengers were infected. Despite their interaction at the ceremony, no person with illness was found at the other bus. So this phenomena suggested that the infection was due to the aircon recirculation mode. Okay, this particular paper study on the simulation of computational fluid dynamic analysis on gas flow in an indoor space. Okay, I think that somehow this study could show that we can create a safe zone inside an indoor, so that if there is any chance that we want to apply this in the current pandemic, it could be a fundamental reference. Okay, in a natural diffusion flow, we can see that if a certain source of flow or flow could be created, we can see from the flow study over here that certain area in that room could be designated as a safe area. Even in the case that aircon was turned on, still, if somehow a flow could be intervened in that room, a safe area still could be confirmed.
Dr. Ridha, can you maybe explain what are the red
Yes.
color and the blue color? Some people might not
Okay, sorry.
understand.
Okay, the red color is showing okay, on this natural flow. So we can see that the red color here over here is the origin of the contaminants, or in this case we could say maybe the source of the virus, or maybe in a clinic setup we can say maybe the patient is sitting here. Okay, so maybe we can set the aircon direction, or maybe a decontamination uh, apparatus at certain direction, so that this area could be controlled. Similarly, if you have a air condition on, that particular device could be pointed at a certain direction. Based on this analysis, it has shown that if we can, on the other hand, the door or maybe the doctor and nurses could be always be present at the safe area. In a case that a patient or the contaminant exists in that room, um, uh, based on the positioning and the direction, we could create a safe area in an indoor space. Okay, the next study is in a little bit backdated in 2014. It's just showing how aerosol measurement was measured in an experiment. Images from the club released by a cuff event at on figure A, 0.006 seconds, B 0.01, C 0.029, and 0.106 seconds. And then figure E is showing the ballistic trajectory of the largest droplets during cuff, and figure F is a smoke visualization of the motion of the gas phase record at 2000 frames per second during the cuff. Okay, and then the next slide is showing the aerosol measurement experiment during sneeze. A person is sneezing, so we can see flows from homogeneous fluid from a local source is categorized into 4: jet, puff, plums, and thermal. So we can see the different for jet and plumes is that it originated from the same source, which is the person mouth. It carry a momentum from the cough, from the sneezing itself, and then as the aerosols or the droplets fly, then it create a plumes movement, which is from the buoyancy or the excess of gravity due to the density differences. Okay, airborne transmission of SARS-CoV-2 framework is used in this workshop over here. Factors such as aerosols, droplets, exposure time, infectious doses, and environment are the main factors. 4 categories of intervention pointed out are: number 1, the source control, where the origins could be reduced, if not completely eliminated, then we could prevent the disease from further spreadings. And number 2, the use of effective ventilation system, okay, the control of airflow in and out of the building. This is very important. And number two is that this ventilation system consists filtration system that could filter the aerosols or the droplets by HEPA or ALPA filters. And then the third one is the maintaining of distance and the using of personal protective equipment. Okay, these interventions can offer protection by reducing a person's exposure. The final intervention would be the maintaining of hygiene. Research indicates that the highest viral loads or positive samples can be found on the floor. Therefore, the practice to keep the space, especially the floor, clean is very important. In the scenario here, I want to show you a simulation study in a bar. In the case that we implement the use of mask by every person and whether the room has good ventilation or not. For a case here, in a bar or in a restaurant where there is one patient, after 4 hours without any safety measures, this one patient could transmit the virus to all of the other people in the bar by the aerosols. However, if all the person in that bar wears mask, a certain number of infections could be reduced. And further, if this space, restaurant space, use a ventilation system that flows air in and out of its building, it could highly reduce the rate of infections. In the scenario B, similarly, in a small room where social gathering in a living room takes place at a house, for example, if there is one patient sitting over here without any measures, he could infect all other person in that living room. However, if all people wears mask, still the infection rate quite high because of the confined space. However, if enough ventilation is provided in that room by opening the doors and windows, infections would be very minimal just to the person sitting in the close proximity to the patients. In the scenario C, similarly, in a classroom, for example, if the patients communicate in a classroom, in a huge classroom, is shown here. After just 2 hours, about half of the students in that classroom could be infected. However, if all students wear masks and all the windows are open and doors also open, infections could be greatly reduced. Okay, these two photos is showing 100 years ago, mask has been effective in preventing droplets and aerosols that leads to virus infections. Now, 100 years after that, it is still relevant in disease prevention. The question remaining is what and how we should do to reduce or prevent transmission in confined spaces like this. With that, I end my presentation today. Thank you for listening.